What are adaptogens and how can they be useful for mental health? My name is Dr. Bliss Lewis. I'm a psychiatrist and an integrative medicine doctor, and let's talk about adaptogens. So adaptogens are pretty popular. Lots of people use them. It's a little confusing for a lot of people of like, what exactly are they? There are many different types of substances that are included in this family. And overall, like adaptogens are a group of usually plants, like it's herbs, it's mushrooms, it's certain supplements, right? So not medication, supplements, which make the body more resilient to stress, right? So substances which we can take in that will make us more resistant, right? Stronger against physical, chemical, biological, right? And emotional stressors. They make us kind of like give us a thicker skin, right? And these are not new, right? These have been used for thousands of years in ancient medical systems, in Ayurveda, in traditional Chinese medicine, in Siberia, and they have a variety of different applications, right? And the different adaptogens have somewhat different benefits. One of the most popular, well-known, well-researched adaptogens is ashwagandha. And a note, none of these are that well researched, right? These are not medications. They don't make anyone money. These are supplements, and the research studies are usually small, not that long in duration. But we have some research. So ashwagandha has been used for stress, for anxiety, for sleep, for enhancing cognitive function, for reducing stress response. The doses in research are usually between 300 and 600 milligrams. Often on supplement bottles, you may see something like 200, maybe 400 milligrams. And there's some research, not a lot, but some research showing that ashwagandha can significantly reduce anxiety levels in study participants. So at least some research to make us more comfortable with trying this medication or this supplement or this natural substance. Another very popular adaptogen is rhodiola, and one of my mentors in psychiatry, Dr. Richard Brown, wrote a whole book about rhodiola, the rhodiola revolution. And this one is particularly good for boosting and improving cognitive function, especially cognitive function under stress. It might be particularly useful for people with ADHD or people with intense cognitive work. Dose ranges are 200 to 600, but working with a clinician, you can really personalize that and figure out a potentially higher dose that might be helpful. And there's some research showing that rhodiola can reduce mental fatigue and it can improve mental performance. It can help for certain aspects of ADHD. A lot of this research was done in Eastern Europe. There's only a little bit of research in English. Another option is holy basil or tulsi. This one is known for its calming effects. It reduces stress, it reduces anxiety, it can help with just like a calm focus and mental clarity. And the dose range is pretty big, from 300 to 2,000 milligrams in research studies. And there are some small research studies showing that tulsi can reduce stress and improve mood. Another adaptogen is lion's mane mushroom. I have another video showing you the actual mushroom and preparing it in my kitchen. So this is a food. You can take it as a supplement, but you can also potentially buy it or find it and eat it for dinner. And this one can be helpful for cognitive function. It also reduces anxiety, also reduces stress. In research studies, the dose ranges are from 500 to 3,000 milligrams per day. There is research showing that lion's mane was effective in improving cognitive function, in reducing anxiety, reducing depression. So not a lot, but some research evidence to support that this particular adaptogen is beneficial. It's also a delicious, yummy food, and you can just use it as a food in your kitchen. Another adaptogen is ginseng. So ginseng is good for energy, right? So it can improve physical energy, it can improve mental energy, cognitive performance. It can also lift mood, right? So it has all of those benefits. In research studies, the dose range is more or less around 200 to 400 milligrams per day. When working with a clinician, you can adjust this dose range more. And there's some research showing that ginseng can improve mood, cognitive function, and it can be particularly beneficial when people are under stress. So how to incorporate adaptogens? How can you add adaptogens to your daily routine, to your supplement regimen, to your life? So you can incorporate them into your food. Some of them you can eat, like lion's mane. Some of them you can drink as tea, that's tulsi. Some I didn't mention here, like ginger and turmeric, are spices, or you can also make tea or a drink. And if you are getting these as a supplement, it's very important to get high quality, very pure, tested. You want to be careful to not get something that might be contaminated. So just getting good brands, and definitely involve a healthcare professional, let them know what you're taking. And also, before starting any new supplement, or if you have like a pre-existing medical condition or taking medications, right, it's good to like check for interactions with anything else you might be taking. And with most things, it's good to introduce a little bit and to figure out what amount of a certain adaptogen agrees with your body. We're all different. Some of us are very sensitive and tiny doses are sufficient. And some of us need more, right? So for a lot of these, the dose ranges are large. So be thoughtful, monitor, and pay attention to how adaptogens might be affecting you, and figure out like which ones are working, right? There are also a variety of products out there which blend like 4, 5, 6 different adaptogens into one, right? That's a different strategy. So instead of like testing one at a time, you just take all 6 of them, right, to see if that will make you more resilient. So just make sure you stick, even for those, with good brands. So adaptogens overall offer this natural option for supporting the body, supporting mental health, and becoming more resilient in the face of all the stress, physical stress on our bodies, mental stress we're dealing with. And they're pretty easy to add into a routine, but the research is limited, so just be mindful, be wise in how you consider adding these into your overall wellness kit. And feel free to check out some of my other videos on related topics. And thank you for watching. Feel free to comment about your experience with adaptogens and using adaptogens for mental well-being.